All right, so let's jump into this case scenario. Here we have a 15-year-old boy, Joe, who has recently been accused by a female classmate of forcing her to have sex with him. Now, this is a pretty serious accusation, and if true, we're already out of the gate in the first sentence with something that is a sign or a behavior that's, if we term it in both clinical terms and even in kind of criminal or societal terms, we're talking about a violation of somebody else's rights as well as committing a crime. So if anything kind of right off the bat that should concern you or should bring up any sort of differentials is this fact that you have a person, an individual, in this case an adolescent, who's significantly violating another person's rights, in this case a possible sexual assault. And again, in clinical terms and in criminal terms, we're both breaking the law and breaking a person's rights or violating rights. So that's going to be the very first thing, is that accusation of essentially forcible sex, sexual assault. It sounds like he replied that she agreed to have sex with him and then got angry. And she got angry because he went out with other girls. Joe is known as a bully. So we have some other descriptions of him. A bully often gets in fights with other students. Looks like he was removed from his biological mother's home when he was 4 years old because she stood by while he was repeatedly abused by her boyfriend. So as far as environmental notes, that is certainly something that I think, at least to highlight, that there was this removal early on in his childhood because of abuse by the boyfriend. Now, it doesn't specify the type of abuse. Nonetheless, abuse occurred at 4 years old. That's a significant age, which can definitely impact a child. This is certainly something to consider with regard to possible future work with the child or with this person, is just considering that there's the context of childhood trauma. So let me just write that. So we definitely need to consider that as we move forward with the case, but more importantly, down the road for treatment, just knowing that as a small child he was abused. It looks like later he was adopted by his current parents, so adoptive parents when he was 7 years old, after a series of foster homes. So we can see that attachment has probably been an issue, moving from place to place, so not a very stable or structured environment, or it appears to be kind of chaotic or moving from place to place. So we find a lot of childhood adverse experiences going on that certainly should be taken into account, as I usually say, at least as part of treatment moving down the road. Maybe not as part of a specific diagnosis per se, unless there are trauma symptoms that eventually play out, but for sure as part of treatment. So then continuing on, it says that he was an attractive little boy who knew how to be charming. So there's part of his personality, kind of resiliency factors in that I guess he knows how to be charming with others. And yet it goes on to say that he had difficulty controlling his temper and seemed to delight in being cruel to other children and animals. And I need to change the color of the highlighter here because I need to go back and look at symptoms, and I prefer to do that in a different color. So possible, let me jump back to the beginning, possible forcible sex is definitely a symptom of possible conduct disorder. Whenever your behavior is violating or significantly violating the rights of others, borderline or if not criminal behavior, one diagnosis that should rise to the top of the list is likely some form of conduct disorder. If he were 18 years and older, we would then look at possibly antisocial personality disorder. But for right now, 15 is where he's at. Really quick, he's known as a bully. Let me just highlight that. He often fights with other students, so there's another possible criteria that's really fitting with this particular differential diagnosis or possible diagnosis as of right now. We also have going on where I just highlighted, he has difficulty controlling his temper and delights in cruelty to children and animals. And this is probably one of the most significant symptoms of conduct disorder, and eventually what would be or could eventually become antisocial. Kind of antisocial traits is that cruelty, and that's a huge red flag. So let's continue on. I mean, we've really, at this point, we've met already so many kind of behavioral criteria for conduct disorder that even at this point, you could kind of really look at this case as being this particular diagnosis. But let's finish this up and figure out kind of where we're at. Looks like his adoptive parents tried to help him. They worked with the school to control his temper. So even at school, let me just highlight that. So we have another environmental place. So it's not just at home. We have another place where this occurs, which typically the DSM does require that it happens in multiple areas of life. So he finds it difficult to control his temper, and it's becoming increasingly difficult to manage that. Looks like he frequently lied and sometimes stole money from his mother. So we have kind of lying and deceiving behavior. We have theft from his mother, and then began spending time with other adolescents who were known to use drugs. So this is, fairly common. They start to hang out with other kind of juveniles or people that are known to either use drugs or participate in similar activities. And then finally, his school performance, which never had been satisfactory, deteriorated even further, which can be symptomatic of him essentially giving up, which when we're talking about oppositional defiant and especially conduct disorder, when a person is kind of giving up on their future, giving up on school, just kind of disregarding performance, this is also indicative of potentially a conduct disorder. And then finally, soon after he was accused of sexual assault, this final part, then he ran away from home but was caught from the police and arrested. So we don't know the exact time. This is kind of a question. We don't know if it was for a night, for a few hours, but there was a runaway instance, and who knows if that has happened before or after, or is it a frequent thing? But at this point, this is what we're looking at. I think it's important to note, as I mentioned earlier, that there certainly is kind of early childhood trauma to be considered. However, as we finished up the scenario, we're really not seeing anything that's indicative of post-traumatic stress symptoms in the current moment, as far as flashbacks, intrusive thoughts, avoiding people and places that remind him of the trauma, all of those things that would indicate current post-traumatic stress. As I've always said, at least from my diagnostic point of view and my belief about kind of diagnosing in the DSM, keeping it in the most current context of what their presentation is for me, that's my idea of kind of being the most appropriate, rather than diagnosing based on potential root causes or possible previous experiences. For me, that gets a little risky because that's not the current presentation. Therefore, it makes it difficult to treat for those diagnoses or provide rationale for a treatment plan of diagnoses that's not currently presenting. So, every clinician's going to look at that different. I just choose to say, hey, let's consider trauma as something that needs to be addressed as far as treatment. However, the current scenario and the current presentation of his symptoms really aligns with conduct disorder. And as we look at conduct disorder, I'm going to the DSM real quick, and we will kind of look at and see the criteria that's been met with Joe. Okay, so I have the DSM with me here, and let me just run through the conduct disorder and kind of see where we're at. So if we look at criteria A, you need at least 3 of the following 15 in the past 12 months. So let me go down really quick. The first category is looking at aggression to people and animals. So often bullies, threatens, or intimidates. Yes, we have that. Initiates physical fighting. We have that one. Used a weapon. We don't really know about anything like that. Physically cruel to people. Yes. Cruel to animals. Yes. Stolen or has stolen while confronting a victim. Don't really have evidence of that. We know that he stole from his mom. Has forced somebody into sexual activity. We definitely have an accusation, and from clinical judgment, it's probably leaning towards a yes on that. As far as destruction of property, I'm not seeing that was necessarily the case in this case scenario. Deliberately destroying others' property, or setting fire. So I'm not seeing any fire setting or destruction of property in this particular instance. Has broken into somebody's house? No. Often lies to obtain goods or avoid obligations. So we do have this instance where he frequently lies. So I'd probably put yes on that as far as deceitfulness. Stolen items of non-trivial value without confronting victims. So we do have this stolen money from his mother. What else? Serious violation of rules. So often stays out late despite parental prohibitions before 13. It doesn't really say, so we don't have that information here. Has run away from home overnight at least twice while living in the parental or surrogate home. We know that he ran away. We're not sure of the time, so we can't necessarily say yes to that question, but it's certainly looking like that may occur or possibly has occurred. And then is often truant from school beginning at age 13. So we don't know anything about truancy. We know that his school behavior is deteriorating. So again, some of those are borderline yes, but we need more information. So as we look through this particular case scenario, we're easily coming up with probably 6, 7, 8 criteria easily at this point, which according to the DSM, this looks like it began when he was around 7 years old. It looks like is when he was cruel to children and animals, and possibly when there may have been some bullying, there may have been some early type of fighting, obviously difficulty controlling his temper. So there definitely is an argument for the diagnosis of what would be then F91.1, which is the childhood onset. We'd need a little bit more information just because we have this snapshot. Well, actually, you know what? It says a few years later. So if he's 7, a few years later, that would put him about age 10. The criteria says at least one symptom characteristic of conduct disorder prior to age 10. So I would say this one right here, the delighting in the cruelty to animals and children, would qualify for this onset disorder of childhood. That's what my clinical judgment would say. If anything, we could do the F91.2, the adolescent onset, for sure. That definitely comes into play. But we do have probably one of the most serious violations, cruelty to children and animals, which is actually 2 different aggressions and criteria meeting this particular childhood onset. So as far as the other specifiers, it's hard to say whether he lacks remorse or guilt or lacks empathy. We can assume that being cruel to other children and animals and the sexual assault, all those things, there's assumptions, but we would need more information. I'm concerned about performance. Again, we have a deterioration in school. We just don't know if if that's something that he truly believes in, that he just doesn't care, or whether that's just he's given up. But again, that's additional information that we would have to ask and see. And then shallow or deficient affect. So without observing him or reading this on paper, it's hard to know as far as affect is concerned. In this case, I would likely then write that this is a severe as far as the specifier goes. And the severe is that the conduct problems in excess of those required to make the diagnosis are present, and considerable harm to others, such as forcible sex, physical cruelty. So forcible sex, physical cruelty are certainly examples of what they say is severe conduct disorder behavior. So this would be my diagnosis, F91.1, childhood onset severe. There are a few other kind of differential diagnosis. Oppositional defiant disorder is a possible. So if I write that up here, ODD, that's a possible differential diagnosis. The problem with that is we need defiance of authority figures. And this case study is more based on his conduct and behavioral disruption rather than opposition to authority and oppositional behaviors. So if a person has conduct disorder, they also can have oppositional defiant at the same time as kind of dual or comorbid diagnosis. But in this case, we really don't have the oppositional components criteria being met. So at this point, ODD, we would take that off our list just because we don't have that. Attention deficit hyperactivity is the other one. Again, we don't have the context of the school performance or the home descriptions enough to know that there's attention deficit sort of criteria going on. Depression and bipolar is, or both are other differentials. We don't have really any description of a depression or any sort of mania or elevated mood. We do have obviously irritability and temper, which could be indicative in certain phases of bipolar, kind of increased irritability and aggression. But again, there's not even close to being enough to say that there is any sort of manic behavior or grandiosity, so we're going to cross that out. Intermittent explosive disorder, we really don't have the context that to know whether or not he instantaneously kind of goes into a rage, and that it's the frequency of the rage as well that could justify an intermittent explosive. So in that case, again, because of the frequency, because of not knowing the exact context of him going into a rage, we know that he fights, we know that he has that temper, we just don't have enough, again, context to know and the timelines to know to meet that criteria. So we're going to kind of scratch that out. And then finally, the last one is adjustment disorders. Now, he definitely has gone through a lot of adjustments in his life. He's been in foster homes. He's been adopted. So certainly adjustments could have been part of his early childhood and part of kind of early presentations. However, we know that adjustment disorders, usually after the resolution of the adjustment, which is 6 months, the DSM tells us that after 6 months, we really need to kind of adjustment is no longer or should no longer be considered after it resolves. So after he's established in a foster home, that's pretty much it after 6 months. So in this case, here we go. So we're still going to do conduct disorder. Let me put this. So conduct disorder, childhood onset, severe is going to be probably the most appropriate diagnosis for Joe, the 15-year-old boy.